Welcome to Both Sides Now, featuring the unconventional duo, Dr. Shirley and medium Kelly White. Two perspectives, one world. This is Both Sides Now.
Well, hello, everyone. Welcome to Both Sides Now. I'm Dr. Shirley.
And I'm spiritual medium, Kelly White.
And John, where is that cute little face of yours?
I'm here somewhere in the background, as usual.
Well, glad that you're here, and thank you for joining us. Kel,
Happy to be
we have a
back.
shout out
Well,
for
before we even do the shout out,
Lee.
do want to
Right?
say happy. First,
Yeah.
I want to say Happy New Year to all our Jewish
Yes.
fans. It's Rosh
Mhm.
Hashanah, so
Yes.
Lashana Tova to everybody. It's the
Yes.
year 5779.
Wow. Happy
In
New
the year,
Year.
do you remember that song? In the year 5555. Do you remember that song? Or
I
2525? You
I
don't
do
remember that
not.
song? Oh,
No,
I have to look that one up. It's a good one.
I do.
Wow. Oh, and I
So
do
who's
want
a
to do a shout out to Lee, my
That's right.
friend
It was
Lee. Hi,
Lee. Yeah.
Lee. He's so great. He's a big fan of ours. So,
I hope to meet you soon, Lee. So, let's start with what's going on with the energies and the planets and all that craziness.
well, it is a craziness time. Now,
Yes, it is. It has been all year almost, hasn't it?
oh, completely all year.
Geez, this year has really rocked everybody's world, I think.
As I was saying, that September really was an intense
Mm,
month. Now we're in October, and October tomorrow
mm,
is going to be intense. I know I sound like a broken record, but this October is not going to be like any October that we have had before. It's up there with September. This is an intense time. We're going to have major revelations this
mm.
month,
Oh, that's interesting.
especially towards the end of the month. I'm kind of just going to do a few of the highlights, and then every week I'll go over some more things. But this starts with on October 3rd, Pluto goes direct. So
Hmm.
Pluto's been in retrograde since April, actually, and we have Saturn direct. So when Pluto is also now going to be direct, that brings inner transformation. So you can expect from yourself that you're going to be learning a lot, going through a lot, and a lot of change, a lot of transformation in the way you think, feel, process, and in actuality, things that will happen that'll be different for you for
Mm,
this month. So it's a very interesting dynamic time. Um, and at the end of the month, we have a planetary alignment that brings change and transformation, more so even. So
mm.
if this were not enough, in addition to this, it also brings more serious time for everybody. Could bring depression. It could bring you into spirituality. So it's a good thing that we're talking about different therapies today, because it actually will
Yeah.
hit in this. But in addition to all of this, Mars is transiting in Virgo. And so that's going to make us all look at our health from every angle, physical
Mm,
health, mental health. Again, we're going to be talking about therapy today, but disease. It will also bring an intense flu season this year.
hmm.
So during
Wow.
this month, the next month, I mean, because of this Mars transit. The other thing, Mars is squaring Saturn, and that's going to bring delays. It's going to bring frustration. It could bring some. And then later on, Mars aspects Uranus. That could bring accidents and major events, floods, storms, earthquakes. So this month kind of covers it all. It's
Wow.
intense. Yeah, it's intense. The good news about this is Venus is in Libra for pretty much the whole month, and that brings balance. So our life, anybody who's been out of balance, which most
Hmm.
people are, it's going to bring you into a balance. I didn't
So
say
I
that's an
wonder,
easy, but it is going to
right?
be
Well, that's what I was
balance.
going to say. I wonder if then whatever you're going to experience or whatever you're going to go through is for the the is to bring you in balance, even if it's something that's difficult to deal with or to get
Yeah.
through.
Everything that is going to happen this month is evolving for the greater good of your soul and the greater good
Mhm.
of the planet, actually.
Hmm.
So, yes, and there's going to be a lot of bringing back to balance. And so, if you put out negative during this period of time for the month,
Mhm.
if you put out negative, you are going to receive negative. If you put out positive,
Mm.
you're going to receive positive. It's a
A nice
real
reminder.
important, yeah, last reminder, it's a real important energetic time. And John and I were talking before the show at the end of the month. we get towards this veil of the, like on Halloween, the veil is very, very slim, very limited veil.
Mm.
And so it's going to be a very sensitive time, particularly if you're mediumistic or you're medium or psychic.
Wow.
Yeah.
So
So
by sensitive, what do you mean? That you might
you'll
get
be,
more
yeah,
messages or?
yeah, and easier to read because
Oh,
there's
okay.
the veil is kind of lifted
Okay.
between the two
Huh.
worlds. So it's a very this October is an intense time, and there's a big full moon on October the 13th, and we'll go week by week. We'll take a little bit. I kind of just wanted to give a highlights of October.
Yeah. So basically, brace yourself and be prepared. Is that what you're telling us, Kel?
And probably if you need to go into therapy, which is a great segue for this, we're going to talk
Mm-hmm.
about therapy because you'll be learning about yourself. And I always want to remind everybody that we come into this world so we can learn about ourselves. So we're constantly expanding us.
Mm-hmm.
So
Yeah.
it's a
Yeah.
good time to actually go into therapy. It's
Yeah.
funny. September, first day of school, it's kind of a good time to go back.
That's so interesting. I mean, I think if we kind of can change, and I think it is changing, but if we can kind of change the association with therapy as a chance to get to know yourself and evolve and live to your
Mhm.
potential, as opposed to there's something wrong with me, so I have to go to therapy. I think it is shifting, but I would really love to see that shift where it's
Mhm.
something that, when we go to a doctor and we have preventative medicine,
Mhm.
we don't wait, at least for the most part. If we could help it, we don't wait until the disease hits.
Right.
So the same thing with us. It's an opportunity to get to know yourself and to grow and to evolve, as opposed to there's something wrong with me, that's why I'm
Mhm.
going.
Absolutely. And again,
Yeah.
we incarnate to evolve and to grow. So we will come in
Yes,
with
I know.
particular things we need to work on. And so what better is to sit with somebody for a good hour and you're sitting with them and you're telling your story, they're listening to your story, and you're trying
Mm.
to expand your knowledge of who you are. Where are you and who are you?
I know, because when I said yes, I know a moment ago, I meant, yeah, I know it's tough. We come here to deal with tough
We
shit.
do. We do.
So,
But
yeah.
it's so funny. I was thinking about this today. If you talk to anybody that was like from the 1800s, they would be like,
Mhm.
"You have it tough?"
Right, exactly.
Oh yeah,
Which is
really? We
true.
didn't have toilet
Which is
paper, so
true.
shut up,
It's all right. It's all about perspective. I get it.
Totally.
But, but interesting. It was like, we'll get into the Maslow hierarchy of needs. They
Right.
had it tough because their basic needs, they had a difficult time meeting their basic needs
Right.
of shelter, food, and all that. That's fairly easy for us. My goodness. Um,
That's
little
not
dog is
mine.
barking.
That's not my dog barking.
Little dog is barking. Um, but now we're dealing more with the higher, not higher level, but the more not tangible emotional
Hmm.
stuff.
Yeah, this is true.
So yeah. So why don't we get started talking
Well,
about different
let's.
therapies and how to identify how to find out what therapist is best for you,
I think that's really
right?
good. So when I went to grad school, which was 10 years ago, what they make you do is find um, a direction to find your lens. What do you
Hmm.
resonate with? What theory works for you? So I'm going to
Hmm.
tell people how it works on the therapist end and then what it's like to find the person that you're looking for. Because a therapist, when they go to grad school, they come in with their own baggage, their own
Oh
stuff,
yeah.
their own issues, their own traumas, their own whatever. And then they,
Hmm.
from their own life experience, will have to choose a lens in order to view the person in the therapy room. So
Hmm.
I call it a lens. It can be a theory. It's something that they can in their brain use to help guide the soul that's sitting in front of them.
Hmm.
Now in
I love how you put that. That's so
well,
true.
as a spiritualist, I'm going to say the soul in front of me. Now, in
Yeah.
in grad school, they don't say that. In grad school,
No, they don't
if
say.
you're a PhD, they'll say your patient, and if you're
Hmm.
an MFT, they'll say your client. Ironically, as a medium, you say the sitter. The person in front of you is the sitter. So it's
Yeah.
funny the different terms that we
Yeah,
use.
it is. Right, right.
So, and I can tell you from me, and I can start with here, and we can go to
Hmm.
different theories. My mother was a humanistic existentialist. She was a
Yeah,
theistic,
yeah.
which meant she believed in God, and she was an existentialist. So an existentialist. When I was in grad school, there were only two of us. In fact, Shirley, my friend Randy, who later was your intern, she and I
Yeah.
both were existentialists, but we were older when we went to grad school, both of us.
Mhm.
And it's almost, I want to say, almost a lost art, probably, the existentialist. But existentially speaking, because I was brought up with it, it was the best thing for me to do. It
Mhm.
it means it when you find a therapist that is humanistic or humanistic existential, it means that you're there with the relationship. So it's, they
Mhm.
call it the I thou relationship. So you and I are in therapy together on equal footing. I'm not the expert in you, you're not the expert in me. It's the relationship that heals. And
Yeah.
the whole idea behind existentialism is to create meaning in your life.
Mhm.
That's really what it is. It also means you start from the here and now. You don't go back to childhood. We really don't care. You start right at the here and now. Where are you
Mhm.
now? What's going on? And there's free will, and then there's responsibility. So you do have responsibility for your, yeah, we have free will. Go ahead, do whatever.
Mhm.
You're going to have
Right. Right.
responsibility for that. So, and it's a philosophy. It's not actually a theory, it's a philosophy. So it's a little different. Um, and so that's the way I view it. And then I'm also a spiritualist. So I take this a little further, and I really just go in about the soul, and I use my intuition and go in with the soul and discuss. Um, th- Anybody who's in therapy with me, I always want to know what their soul is up to, how they got there. Let's move on. Let's expand your soul for
So
the
you
growth
always
of your
talk about
soul.
soul purpose.
And the soul purpose. Let's get you your soul
Yeah.
purpose, because I feel that if you know your soul purpose, you're going to be like a beacon of light to get to that purpose.
Mhm.
You're going to want to do the purpose, and your soul's going to feel grounded, not anxious anymore. You're going to have
Yeah.
got arrived where you need to be. So that's
Mhm.
how I view therapy when I do therapy.
Yeah. Yeah. Well, it's funny because they pressure you into choosing
Hmm.
choosing a lens to see
A
it through.
theory, a lens. Yeah.
And when I did high school in Argentina, I had a year of psychology, and the professor was just so passionate about Freud. I just fell in love with Freud.
Ugh.
He was my guy.
Oh,
He was my guy.
really?
I fell in love with him. And I think what I fell in love with, which I still like about him, is his curiosity of,
Okay.
why is it that your favorite color is blue and mine is pink? Mine is yellow. Like, what causes that
Hmm.
difference? And he had that curiosity, or at least the philosophy of it has that curiosity. But he was, coke addict and weird and stuff. But then, of course, you and I had the encounter of a true psychoanalyst, because I always wanted to go. There's a school of
Hmm.
psychoanalysis here in LA, and I always wanted to go and take that extra 2-year training. And it is, as we found out, very, very, very rigid.
Yeah. Explain what a psychoanalyst is, and then we'll tell the story, because it's a hoot.
It is a hoot. Well, a psychoanalyst is not supposed to, very boundaried, not supposed to show anything about themselves. If a
Hmm.
patient asks something about you, you're supposed to say, what is that question? How would that question help you if you answer? You never answer the question.
Hmm.
You never, and the patient sits on a couch and you sit behind them, lies on a couch and you sit behind them. So
Okay,
there's
that's
not a
just
lot of
bizarre
eye
to me.
contact. Well, let me tell you something. My There's this gentleman who works with energy, chi energy, trained in
Mhm.
Japan, that I go see. His mother was having an affair with Eric Fromm, which is a very well-known psychologist. He
Wow.
was a student of Freud, and he goes, "You know what's funny?" He goes, "The only reason why Freud came up with the couch is because he had such an anxiety disorder. He didn't want people staring at him for an hour, and he thought it was kind of weird if he put two chairs one in front of the other. So he saw this beautiful Victorian couch, and that's where he came up with the idea that the patient lies on a couch and he sat behind them so they didn't stare at him for an hour." And he goes,
Wow.
and psychoanalysts think that that's the way to do it, and that's the way they do it. And to me, when
Wow.
someone comes from not a lot of attunement or not a lot of hugs and warm and fuzzy feelings as a little kid, that's what you need. And and that, to me, can be so cold. You re-traumatize. You have the potential to
Hmm.
re-traumatize your client every week because it's such a cold environment. I mean, we want to tell the story of what happened to us with the psychoanalyst.
Yes. Yeah. Well, yeah. Why don't you start it? Because it's unbelievable.
Well, we had a, I don't want to make it too long, but we had to move out of our office, and there was this wonderful woman that I would run into the bathroom, went into the bathroom, and she was a lovely woman. And she was a psychoanalyst, and we thought, oh, let's all move in together. So we were going to, and then she came and we had a meeting in our office, and she
Mhm.
noticed we served coffee
In fact, I actually said to her, "Would you like
to
some coffee?" Because again, I'm a humanistic existentialist, so
Mhm.
it's the
It's about the
relationship. Come
relationship.
on in, have some
And
coffee.
and let me just say this, all of the research shows that above and beyond whatever theory you use,
Yeah,
the relationship is what heals the most.
absolutely.
Yeah.
Mhm.
So anyways, she had a huge issue, remember, about
Oh,
serving coffee and that they don't serve coffee because they're not supposed to serve coffee. And how
yeah.
would it be if two patients show up at the same time and we
Mhm.
offer coffee to our patient, but she can't offer coffee to her patient, how would they feel? And it became this big thing. And so then I said, because at that point I knew that
Right.
I didn't want to move in with this woman. So Kelly's sitting there and we're all in a circle. And I said, well, look, I've got nuts too. And Kelly's a medium
Yeah, yeah,
because I
yeah. She
wanted to
threw me
really turn her
right
off.
on the bus. Of course, that did it. So we don't work with her now, which was
I can't,
hilarious.
it's
So
hard. I know that
neurotic.
some therapists have boundaries, and I think that that is, you have to be boundaried.
Mhm.
A self-disclosure can only happen if it's going to help the person, but if it's
Right.
not going to help the person, I've gone to parties and I see a patient and I'll leave, you know.
Oh yeah.
So there is certainly something to be said about being boundaried, but the rigidity of the psychoanalytic, you know, theory is, to me, I
Mhm.
feel that it can re-traumatize people, so I don't
Right.
buy into that.
Now,
Yeah.
there are Jungian therapists out there that you also go to school for an extra year or two to become a
Hmm.
Jungian. Carl
Yeah.
Jung was he was a student of Freud,
Yeah. And then he
and
split up.
then he split up. And do you know it's because he was a spiritualist. He
He
used
was ahead of his
astrology,
time. I
way ahead of
love
his
him.
time.
Yeah.
He used
Yeah. Yeah.
astrology, he used archetypes, he was really a spiritualist. And
Hmm.
so I loved Jung. I loved
Yeah.
Jung. And if I ever
Yeah.
have a chance, I'll study in the Jungian Institute if I ever get
Yeah.
that chance, because my mother went to school in Switzerland at the Jung
Did she?
Institute.
Yeah.
Yeah, she
Yeah.
loved it. But it really brings about a whole new way of doing therapy, you know.
Hmm. Right, right. And I'm sure that most people have heard of cognitive behavioral,
Yeah,
which
let's
is the
talk
kind
about
of
that.
the one that most people use. It has the most research because I think that's the only one that people used a lot. And so it did have the opportunity for a lot of research. And basically, it's what it is. Cognitive is about our thinking, our cognitions, and
Hmm.
behavioral is about how we behave. So the idea is that you explore how you think and what your negative thoughts are, or your thoughts that get in your way.
Hmm.
And then you start to do behaviors and start to do things different. So, when you have a negative thought, you do thought
Right.
stopping, you stop that thought, or which is great as a tool, not as a
Yeah,
therapy, in my opinion,
I
because
agree.
there is no curiosity as to why you think that way. And unless
Hmm.
you get to the bottom of why you think that way,
Hmm.
you're just dealing with the symptom. It's like putting a band-aid on a wound.
Hmm.
It can fester underneath. It's
Totally.
not going to, so I don't agree with that as the only type of therapy, or as to looking at it through the lens of the way you
CBT.
think and changing your behavior. Not at
Right.
all. Now we have a question from Shar. Do you feel psychoanalysis is necessary for diagnosis? I'm not sure what you mean by that. Do you have an
I'm
idea,
not either.
Kelly?
That's why I was giving it to you. I mean, psychoanalysis it would be like a Freudian therapy or
Yeah,
object relation or something like that.
the
But
type of
anybody,
therapy.
let me just explain this, Shar. Anybody that's a therapist can give you a diagnosis. So whether you're an existentialist, whether
Mhm.
you do Freudian, whether you do CBT, and often the diagnosis often is anxiety or depression or something like
Yeah,
that, but anybody that's a licensed therapist can give you a diagnosis, and I think
right.
psychoanalysis gives it probably a longer version possibly of a diagnosis.
Well, if psychoanalysis is just one type of
Therapy.
way you do therapy, and
Mhm.
diagnosis is straight across the board.
Right.
And we have the diagnostic manual, the DSM, which is
Mhm.
it's on its fifth version,
Fifth. Yeah.
and that every therapist uses, every psychiatrist uses, regardless of orientation, and that's where
Mhm.
you get your diagnoses. And I think there's so many therapists that think that it's not a good idea that we label people with. To me, it's a guide. It helps
Mhm.
guide into either what to expect or what to know, or even normalizes it for someone. Oh, I've got depression, that's why I'm feeling like this and like this and like this
Right.
and like this.
Right.
but
And
not to get stuck there.
not to get stuck there, and unless you have to give a code for insurance purposes, not
Yeah,
to get
because
stuck
insurance
there.
won't pay.
So
Right.
why don't you take this question, Cheryl?
So one is asking, what are my thoughts about EMDR, which I am trained in. And I think that those, these other therapies that have been coming up, there's a lot of research behind EMDR. And basically, Dr. Shapiro discovered it because she was literally walking down the beach and she was thinking about one of the issues she was dealing with, and her eyes started to dart back and forth, or left and right.
Oh.
And so it's bilateral stimulation of the brain.
Mhm.
And somehow that kind of, consolidates the trauma, and
Mm.
it helps the trauma to not, the effects of the trauma, whatever traumatic experience you had, to not affect you anymore. So
Mm.
you can then remember what happened, like an accident, but it's not going to affect you in the here and now. So somatic experiencing, is another type of trauma that helps, another type of therapy that helps with trauma. So what happened to you doesn't have to affect you. And I think it works really, really well. I highly recommend it. For some people, you have to be careful. It's not,
Yeah.
one size fit all. Everybody's not going to do well with EMDR, and you have to start very, very slow. But it works, for example, if you're anxious. Sometimes this is called the butterfly hug, and they use it with kids. So you can just tap like this, and you can do it very
Hmm.
subtly, like on the side of your leg. And it's just bilateral stimulation of the brain, and that just kind of helps
Like to calm you, keep you.
calm. Yeah,
Okay.
yeah.
And what's the difference between EMDR and somatic experience?
Well, EMDR doesn't focus as much on the body, and somatic experiencing focuses all on how your body responds to something, to a memory,
Okay.
you know. And that's when, when you were talking about what you chose, and you chose humanistic existentialism because you kind of were brought up in it and you heard
Hmm.
about it, and it felt, I hadn't really chosen one. I mean, I had chosen one just for the sake of school, but nothing that really resonated with me. And in fact, I didn't do such good work, because I couldn't get to that deeper level. And it wasn't until, and this is how I start my book, it wasn't until this fateful trip to Tahiti, where I went just to get all my continuing education units, because they gave them to you. It was a trip that you can take your family with, but it was continuing education because it
Right.
was this psychiatrist that was teaching about. I didn't care. I just went, great, I'm going to Tahiti with Sid, you know?
Right.
And he started, his first lecture was on attachment theory. And I realized he was describing me. And I started to make sense. And I came back and took everything. And that's what got me into neurobiology and attachment theory, which I think is, and that's now the lens that
Yeah.
I view it in. We all attach. Every single mammal attaches. That's why when, a dog will make more fanfare for the owner than for everybody else, they
Hmm.
want attention from everybody else. So they wag it. But they recognize the owner above and beyond anybody else. That's an attachment. We all attach, and depending on how, it all depends on how attuned your primary caregiver was. We can
Okay.
attach to a lot of people. A baby will have one primary caregiver in the first 18 months they attach. It's usually the person they're mostly with.
Hmm.
So it could be mom, but it could be dad. And then there's other secondary attachments, and how attuned that person is. It's
Mm.
it's it's all the research shows that. So if that person was attuned to your needs, didn't let you cry too much, and kind of figured it out, oh, you just want a hug, or oh, the baby's hungry, or whatever, you got secure attachment, which means that, doesn't mean you're not going to feel stuff, but you have this core knowing that you will get through it.
So when
You will
you're in
get through it.
when you're in therapy with somebody, how do you determine what kind of attachment they've
Oh,
had?
I can almost tell in a second. Now it's on a huge continuum, but like, so for example, myself, I put in the book that I'm avoidant attachment.
Mhm.
And the more therapy you do, the more you can get to that secure attachment. So it's not, um, because my mother, who was, who certainly meant to do the right thing, was a stay-at-home mom, but there was not a lot of interaction. And so as a little baby, I kind of shut down my needs and said,
Mhm.
okay, no, I don't have any needs. And oh, thank you,
Uh,
John, for putting up my book with the stupid title. Um, so so you kind of, you're the do-it-yourself person. You grow up into the do-it-yourself. No, 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 I don't need any help. No, I'm fine. You asking for help or feeling that you have needs brings up a lot of shame, even though it may not feel that. But and then on the other side of that is the ambivalent attachment, where the parent was sometimes there, sometimes not, sometimes met the needs,
mm,
sometimes didn't. And so they're more the anxiety people as adults. Oh my God, he was going to call me at 6 and it's 6:02. Do you think he's left me?
Mm.
and it's almost like a barrel that never gets full.
Yes.
And they view thing, if you're not with me and you want to spend time with your friends, it doesn't just mean you want to spend time with your friends, it means you'd rather not be with me.
Mm.
So there's this, and so understanding it from that then informs how the brain developed, that informs me how you react, how your nervous system is going to react, and that's kind of how I view it. And then we go and we do whatever we have to. So
Mhm.
I use somatic experiencing techniques. I can use cognitive behavioral techniques if I need to, but that gives me the foundation, the basis
Mhm.
of what
So when
happened.
you walk in a room with a patient, do you call
Hmm.
them patients, right?
I do, because your mom trained me that way.
Right.
But
Right.
I don't think there's a right, I don't think we have found a word that kind of really describes, you know,
Yeah.
because I'm a patient too. I go to my own therapist. So,
Right.
and client, I don't know, is kind
Yeah.
of cold, and you
Yeah.
can't call them friends. But so I don't know. We haven't found a good word. Maybe you and I will come up with a good word
Okay. We'll have to
to
work on that.
describe. Yeah.
So, but if somebody comes to see you in therapy, you're sitting there, and the first thing you're trying to do is figure out what kind of attachment style they have, and then from that lens, you kind of go into more of different. You can view their situation.
Yeah, I'll notice. So they come in and they say they were having issues with their wife or their
Mhm.
husband, their
Okay.
spouse or their boyfriend and
Right.
stuff. Well, there's a reason for that, and so I'll start to ask questions. It helps, choosing a type of therapy to view, you know, your client with also
Mhm.
informs the questions you're going to ask. So I'll ask questions so I can start to get an idea of what their attachment is. And I
Mm.
always ask, a story about their childhood, just because that gives me an idea of how they felt, if they felt safe, if they
Oh.
felt unsafe, that kind of thing. And so that's
Mhm.
how I move forward. Yeah. Yeah. But somatic
Okay.
experiencing also changed my life, because it's so much about how the nervous system is. Susie, you're asking, how do you treat PTSD? Nothing has worked for me. Somatic experiencing, that's the way to treat PTSD.
Yeah.
Talk therapy has its limitations in that you can, especially when you have a big trauma that causes PTSD, in that you can talk about something, you can make sense of it, you can understand, and then what do you do?
Yeah. Yeah.
So I would find a somatic experiencing therapist. And John, if you can put up the link so people can look for practitioners in their area. Just because they're trained doesn't mean they're good. So give them a call, talk to them on the phone, see how you feel with them, if you resonate.
Mhm.
And or EMDR you know, can also be helpful in PTSD.
Mhm.
What about you, Kel? What do you think?
I always said if there's going to be that type of PTSD, I send them to you. Well, it's funny. Shirley and I have an interesting situation because sometimes a client will call and they'll see you, and then you'll say, I think you really would be a better fit with Kelly. And
Mhm.
I, on the
Yeah,
other hand, will say, I think you're actually a better fit with Shirley. So we have that ability without any egos has
yeah.
present. We have
Oh,
the
yeah.
ability to do that. So it's a great question. How does one pick a therapist? So, I mean, I think what you do, Juan, is you find out everything you can about the therapist. What is their background? How long have they been practicing? What do they again? What is their lens? How do they view the therapy room? Are you the
Hmm.
patient and they're the expert? Is it a relationship based? Is it somatic experience based? What kind of training has the therapist have? So when somebody
Hmm.
calls me, first thing I do, because I'm very open about who I am, first thing I say,
Hmm.
is this for a reading or is this for therapy? And I mean, I back in the day we couldn't do that. I
Yeah.
do this now, and
No, you
I
didn't
will.
do that back in the day.
We didn't do it. But now what I can say is that, and I'm going to start in January. I've been postponing and postponing because I haven't had time. I've been so busy. But there are a bunch of therapists now that are moving in the spiritual realm. And so a lot of
Hmm.
people have asked me to help them with this to do it. So in my case, I was a medium first, then I went to grad school. So when somebody calls me for an appointment, first thing I do is I find out, is this for a therapy or is this for a reading? Oh,
Hmm.
you do readings too? Well, and then it kind of throws them for a bit. And then I
Hmm.
explain, well, it's just for therapy. So with somebody like me, I would say to you, look, I'm a spiritualist. I work with the soul. I work with why you're here. Of course, we can talk about what's going on now, and I help you guide you through a lot of that. And
Hmm.
that's the way I work. Shirley, if
Yeah.
somebody were to pick you as a therapist, what's the first
But
thing
I
that you do?
think I think, because I've had that question when someone calls me, how do you work? Because
Hmm.
they've gotten a few referrals and they want to know how
Right.
to pick a therapist. I think, first of all, you have to feel their energy. That's why I say always call them up or at least go for one appointment and see how you feel with them, because
Mhm.
you need to feel that you'll be able to trust them enough to open up, because otherwise it's pointless, right?
What's the point? Yeah.
Exactly. I would choose someone that's flexible, not someone that's so rigid. So, as an example, I have someone who sees me as the therapist, doesn't want any kind of connection with me outside of
Right.
therapy, and so I respect that, and I don't. But there's some people that are having a hard time, and I don't mind them texting me, and I'll text them right back if I know that that's what they need. Um, if I realize that someone is, wanting to cross a boundary, and I don't think that it's an emergency, then I won't. And I let them know from the beginning, you're always welcome to text me. I may or may not respond in that moment, but at some point I will. So, but I would choose someone who's flexible, not someone who is so rigid, because in my opinion, that
I
says
agree.
something about them. And
Yeah.
I wouldn't want a therapist that's rigid. I wouldn't want a therapist that crosses the lines, but I certainly wouldn't want someone that's too rigid because it doesn't fit my personality. There's
Hmm.
some people, like my sister, for example, is very kind of in the box, and she'd probably do better with someone in the box,
Yeah, she probably wouldn't do well with me.
So, but interestingly, just because I know my sister,
Mhm.
she would, it would be more advantageous to be with someone like you
Probably.
who can kind of help her, you know,
Expand.
loosen, become more
Loosen
fluid
up.
in her box.
Yeah.
But nonetheless, you have to find someone who, so figure out who you are first. Are
Mhm.
you rigid? Are you more flexible? Do you want
Right.
more flexibility? Is your therapist flexible or not flexible? So those are the kind of questions that I would ask
Hmm.
too, you know.
It's so interesting. When I was the oldest one in my graduate class, second oldest actually, my other friend was a little older than me. I say this because people assumed that that I'd been a therapist forever. I had
Mm,
certainly grown up with my mom as a therapist, so I had certainly learned a lot along the way, and I had a lot of life experience. What I was going to say is that there are these young therapists that are starting off now, and I'll
mhm.
tell you what, I used to think, oh, well, they have no life experience. I mean, really, seriously? Wait a minute. Some of them are very good. Some of these young ones are good. If you get a
Yeah.
young one that's smart, that's like a
Mhm.
amazing. So
Yeah.
if they don't
Yeah.
have want to find out, listen, some therapists will answer the question. I always answer the question, have you been divorced? Are you married? Do you have kids? They want to know because they want to know if you can relate to them, for goodness sake.
Exactly.
I had one
Exactly.
experience once, I will never forget this. I was going into therapy myself, as years ago. I walk in and everybody had referred this guy to me. Oh, this guy is so good. He's so. I walk in, I take one look at him, and I almost flipped. He looked just like my first ex-husband. I go, up, peace out, gotta go,
Right. Gotta go.
gotta go. So that
Yeah.
happens. That happens.
Yeah, yeah, that does happen. And it could be a good idea that he triggers that so you can deal with those issues, or it could be a bad idea because it's not going to get you to feel comfortable and safe enough in the room to be able to talk about stuff. But
Yeah.
another thing that I was thinking about is when you were curiosity.
Mhm.
The therapist needs to be really curious. Do you want a therapist who's more active or less active? I had someone
Right.
call me the other day and say, listen, I interviewed this other guy on the phone, and he was very passive, and passive doesn't work for me. I need someone who's going to be active, who's going to be there in the room with me, who's going to ask me questions, challenge me, tell me the things, that I should be doing, or
Mhm.
like homework and that kind of stuff.
Mhm.
Or do you want a therapist who's going to hold the space for you and just kind of go, mm-hmm, mm-hmm, which some people need that. So that's what I mean by, by get to know what
Right.
works for you first, maybe
Right.
before, because then you can ask those questions.
This is one of the greatest questions of all, Juan. I so appreciate this.
Mm.
When do you know
Mhm.
it's time to end therapy? Cheryl, you take it, then I'll go.
Well, I think it's kind of, when they come in and everything's going okay. So they've hit kind of this really nice plateau. That doesn't mean that things aren't going to happen that's going to trigger them, or they're going to need, And so I'll suggest it many times, hey, what do you think about
Mhm.
going every other week? Because I don't want to foster a dependence,
Right.
you know, but I also don't want to terminate too soon. But when I can kind of feel where they're just coming in and not really, things are going okay, and they're not really being triggered that often, then I'll suggest it. Yeah.
One of the things,
What about you?
well, there are therapies that are called short-term therapies,
Yeah.
actually, you know? I mean, I think that you get 8 sessions or something. I always think that's kind of ridiculous, but there are
Yeah.
people, and I've been one of these people. Sometimes when I would go into therapy, yeah, I would just need 3 or 4 sessions or 6 sessions or 8 sessions, and that was it. I just needed a little tune-up here or there, and sometimes that happens.
Hmm.
Often, though, what I've discovered is in the relationship, I can't get people to leave.
Yeah.
I'm like, "No, no, no, really, you're doing great." Look, and
Yeah.
then I don't wanna take it as a like I'm offending them, I don't wanna hurt their
Yeah.
feelings, but
Yeah.
it's okay, little one, you can go now, you know?
Right, right. But sometimes it's nice. It's like having, at some point once you've worked through your stuff,
Yeah,
it's like having an impartial person that you can
right,
bounce things off of. So some
yeah,
people will go for years because of that, but not because they're dependent on it.
right.
The question that I get a lot that I never answer because I don't know how is how long do you think this will take?
Oh,
And I'm like, I don't know. So what
right,
I will say, which satisfies people, is why don't we reassess in a month and see how you're doing?
right, and a
But
good
there's no way
therapist
you could tell.
there's no way, but a good therapist will say that, Shirley, "Let's reassess this because you don't know, and especially if
No idea.
somebody's new in it, you have no idea, and, it's interesting with some men, not all men, it's you do male speak. They wanna speak a certain way, they want it done, and therapy doesn't really necessarily work that way. It's a vibration that you're building, you're learning about yourself, you're making changes. Insight doesn't necessarily lead to change, but insight does help you. Then you have to literally make the change.
Oh yeah, I mean it's a necessary first step because
Mhm.
if you're not aware of what's going on, how can you change it? But in and of itself
Right.
won't help.
And interesting enough too, spiritually, we are here to constantly grow. So you don't get to hear and say, "Oh, I've done it now. I can stop growing." It doesn't work that
Yeah.
way. So
Yeah.
there will always be a reason, frankly, probably to come back to therapy to learn
Yeah.
more about yourself because the world this dimension will always push you to a new level that you
Yeah.
didn't think was
Yeah.
possible. It's like, wait
Yeah.
a minute, I learned all of this and I've so grown. Oh, really? Well, watch this, kaboom, and something
Right.
else happens.
Yeah.
So, so you can go in and out of therapy.
Oh yeah, and so I think that's a great point to bring up because some people will say, what's wrong with me? This happened again, or I'm being triggered again,
Right.
and it's because you're alive. You're on
That's
earth,
that's
so
correct.
there's always going to be
Yeah.
the progress is measured in how often you get triggered,
Yeah.
how
Yes.
often you can say, wow, a year ago that would have triggered me, but it's not now. How many tools you have to get through your triggers, and not needing um not feeling lost, or so progress is measured that way, not whether or not you still have issues or you still have triggers. And
Right.
I find that it's wonderful when you have a trigger because then you can tell where you're at.
Mhm.
Like if someone isn't dating and they've dealt with, a lot of stuff and they're doing okay, and then all of a sudden they start dating and all of a sudden all this stuff comes up. Well, it lets them know where they're at.
Right.
And you will always see the progress, you
Yeah.
know, and
Right.
then you will always have things to continue to work with. I think it's like, what is it?
Mhm.
The uh the example that's always given, the onion, but it's such a
Mhm.
beautiful kind of visual for it. It is like
Mhm.
an onion. You peel the different layers
Right.
until you get deeper and deeper.
Right. And the work that you and I do, Shirley, is really interesting too because we use outside sources. We'll call in, a homeopath or somebody that
Mhm.
does yoga or
Mhm.
somebody that, I don't know, different modalities.
Well,
You
I
know.
think there can be so many different entry points,
Mhm.
for
Right.
healing, that it's just not one
Mhm.
size fits all. So therapy,
Mhm.
is great, but then someone's going through a lot of loss and I'll send them to a session with you
Mhm.
because you have a different entry point. And then we'll
Mhm.
send them to a session with Carrie for family consolation
Mhm.
therapy because she has a different entry point.
Mhm.
So I think healing
Very true.
is about coming at it from
Mhm.
different entry points.
And so you might want to find a therapist that's open
That's
because
open to that. Yes.
open to that because often, not often, I think it was back in the day, therapists were, well, this is my patient, this is the way I do things, this is it. It's not that way anymore. You have a voice. You can certainly, to me, as a therapist, you can always ask me any question at any time. I'm pretty much like an open book. I don't know if you work that way, Shirley,
Oh
but
yeah,
I'm very
absolutely.
open
Yeah,
with
yeah.
that.
And also, if I'm not the best person for you. I'll send them to somebody else, because my main purpose, I wouldn't be doing this work if I didn't, is to help someone heal what they want to
Right.
heal or live to their highest potential. So if it's not me, then it's not me.
Right. And
I
that's
don't,
another thing when you're looking for a therapist. You really want to find somebody that really wants you to get better,
yeah, yeah.
you know?
That doesn't, that doesn't want you to just, stay with them. And I would actually ask a therapist if they've done their own work. I think it's the most irresponsible thing to
Mhm.
not do your own work if you're
Yeah.
going to do this kind of work.
Oh, right on. I feel that way as a medium too. I feel that way
Yeah,
as a therapist and as a medium. And when you're in grad school now, anybody who's going back to grad school, you have to be in therapy. You
yeah,
do. You have to do, 300 hours, I think,
yeah.
which
As you
sounds like a
should.
lot, but
It's
it's not.
3,000, yeah. Oh, 300 hours of your own
Yeah,
therapy. And somatic experiencing, you have to do your own sessions.
you do.
And I mean,
Mhm.
and you should, because then you can
Yeah.
feel the power of that kind of therapy. But I remember when I was very green and I was just going to school, and unfortunately, my father, the Asperger's, didn't realize that his jokes sometimes were not very kind. So if I would get upset about
Oh.
something, he would go, and that's the therapist.
Oh,
And so it made me feel like I couldn't have issues, because if I had issues, how can I be a therapist if I have issues?
Mhm.
So I couldn't go to therapy because then I had issues. And then how can I be a therapist? I wouldn't be respected, or trusted. And of course, the exact opposite is true. You
right,
become more human. You become
Yeah.
more,
right,
oh, you can relate to what I'm
right.
feeling. And I learn as much from my patients or clients than I'm hoping they're learning from me. So it's very mutual.
Mhm.
Um, and so, yeah, at first it was very shaming and very humiliating.
Huh.
And then I realized, that no, it's exactly what needs to happen. And now I find it very irresponsible if the therapist doesn't go to therapy, their own
Yeah,
personal therapy.
right. No, I
Yeah.
agree. Yeah,
All
this,
righty. So are you ready for some calls?
yes, we are.
Yes, yes, we
All
are.
righty. So here we go. We got our first caller calling from 815. 815 is on the line. Can we have your name, please, and where you're calling from?
Hi, my name is Brandy. I'm calling from Illinois, Lockport, Illinois.
Well,
Hi,
hi,
Brandy.
Brandy. How can we help you today, Brandy? What's your
Oh,
question?
easy night.
Oh, we're great.
I'm just wondering what kind of where I should move into my journey with spiritualism, and if I should go into more counseling for that.
Well, let me ask you something, Brandy. What's your birth date?
31079.
310? That's my birthday.
You're a Pisces.
Okay,
Oh,
that's
Well, not
hilarious.
79, 66. So I have a few years on you, but 310, that's fantastic.
So I guess I can answer your question. Yeah.
yeah.
Are you considering going into therapy to be a therapist?
I mean, I know I want to heal people and help heal people. I'm just in a rut right now. I think a lot of Pisces are going through it right now, where we're stuck, and I just want to know
Mhm.
how I can move
How
past
you
it
can get unstuck?
slowly.
Well, one of the things that I would do, you come in to know thyself, and you might want to highlight that phrase, know thyself, because Shirley and I were just talking about it. I think, Shirley, you're such an expert on this particular date. I mean, we choose the date we're going to be born. We choose that date for a reason. So you come in as a king of diamonds. King of diamonds is fierce. What will always get you off track, Brandy, and Shirley, remember this, is to not look at the entire picture. You might be blinded by somebody or something. Does that make any sense? Like blinded. You have to pay a lot of attention. Are
Yes.
you there? Yeah. You got to pay a lot of attention
I
because you can't get bamboozled. No bamboozled. You got to stay very focused.
am.
Okay. Because you have a good heart and you think like a male and you're a female. So you've probably had to be pretty tough and pretty rigid, I would think, your whole life, probably. But going forward, this is going to be a great year for you to expand, learn everything about yourself that you can, particularly as Pluto goes direct. It'll help you a lot. This will be a month of growth for you. I'm going to say huge, huge growth and change. So either go back to school, go into therapy, do anything you can to learn about yourself.
Yeah, it's very, very important point that you're making, Kelly,
Mhm.
because when you get in a rut, you have to change up
You have to.
your day to day, and you don't have to wait for something to change. You make the change. You change up your
Right.
day to day, your
Absolutely.
routine.
I
Mhm.
would, John, if you can, I would do a
Yeah.
session with Carrie. It's a one-time session. She does Skype. Family constellation therapy can be
Mhm.
life-changing and really shake things up and open you up to a lot of things. I remember I was in a rut. I've been in ruts along the way, but I remember one specific time I thought, God, I want to change. And I was sitting at the nail salon, the one that we used to go with your mom,
Mhm.
the one in the alley.
Mhm.
And I was getting, my nails were drying, and I never look at a magazine when my nails are drying. But all of a sudden, this magazine was in, it's called W Magazine. If you're from LA, you know what that is. And it had a beautiful picture of Jennifer Aniston in kind of a very 60s with, the black, and for some reason I picked it up, and all of a sudden I'm flipping through it, and it says medium psychics in LA. And I said, that's it. I called every single one of them, and I said, the first one that calls me back is the one that I'm going to, because I just felt that would shake me up. And sure enough, the first one that called me back was instrumental in getting me to start writing my book.
See, there you
So
go.
yeah, so shake it up in that way, some kind of energetic, do a session with even a session with Kelly, with yeah, I think that's going to help kind of pull you
It
out
kind
of
of
that stuck
gets it,
place.
yeah. And
Yeah.
another, John, we can always put Dr. Gramlich's information up again too
Sure.
for homeopathic remedies are very good to kind of get you pushed out and motivated. And
Yeah.
but I would say just get on it. This month, everything goes direct until the end when Mercury goes retrograde.
Sure.
So get on it now before
Yeah.
the end of the month.
Get on it.
Yeah, get on it now. But
Yeah,
thanks for
Yeah.
your call, Brandy. I really appreciate it.
focus. Oh, thank you. I just wanted to help myself focus on this, but I'm having just a hard time with that part. So just got to calm my brain down a little bit.
Yeah, you have a big brain, but good. A homeopathic remedy would be really good for you too. So, John, put Dr. Robert Gramlich's information up.
You got it.
And put Christine too.
Oh,
She's an
she's very
energy
good.
worker that Kelly, you turned me on to her. It's a
Mhm.
1 hour thing. It's on the phone. And again, just a different entry point of she just kind of, you don't even have to ask her a question. You can, but she just goes right in there and she can tell. She works in a very fascinating way. It's hard for me to describe. Can you describe it better?
Yeah, she works with the subconscious, so she goes right into the subconscious.
Mhm.
And
And
she
starts
would
to
be
shift
somebody
things.
that, yes, that really might be a good place for you, Brandy. So yeah, maybe you put her information too.
I
Do you
don't
have it, John?
have yours, but I will get it
We'll
for you.
get it.
Put it in the
Okay.
comments.
We'll
Yeah.
get it and we'll put it on the thing. Yeah. But I think I would do something like that. And if you've not haven't done therapy, I would look up, John's going to put the somatic practitioner,
Mm-hmm.
um,
Yeah. Put that in there.
and start therapy. Do something that's going to shake things up so
Yeah.
you don't stay
Right.
stuck.
Definitely.
There
Yeah.
you go.
I went to go see a medium and I got unstuck.
Thank you for your time.
Thank you.
You're
Thank you.
welcome.
All right,
I
Brand.
hope that helps.
Thank you, hon. Take care.
You too.
Blessings.
All right. So we were getting comments more than we are getting calls at the moment. So we had a comment
Great.
earlier asking Shirley if you could go more into explaining what somatic experiencing is. Must be a new
Well,
listener.
I know because I talk about it
Love
ad
it.
nauseum.
No, I love
Let me actually, this thing that I was reading had such a beautiful description of it. I sent it to you, didn't I, Cal?
You did, but I couldn't find it.
Oh,
Sorry.
hold on.
No
Let me
worries.
find. I mean, basically, it's, anytime trauma, we think of trauma, or at least we used to, as big ticket items. And trauma is we can have the effects of trauma about anything that overwhelms the nervous system.
Uh-huh.
So when the nervous system gets overwhelmed, it's viewed as a threat to the primitive part of the brain. And so your nervous system goes into fight or flight to figure out if you're going to fight the thing that's coming at you or take off running.
Mm-hmm.
Animals in the wild know how to, after the threat is over, know how to kind of release that energy, finish that energy off, release it from their body. And so then they go back into the herd and everything's fine. We don't, because we either feel shame or we stop ourselves, or a huge car accident. What are we doing? We're calling 911, and on the way home, we call our friends and get a load of this and stuff. And we keep ourselves in that heightened
Right.
state.
Yeah.
And we never allow the body to complete and get rid of the residual energy of the fight or flight.
Yeah.
And so then that starts to add on. So PTSD symptoms, chronic stress, and then we start to feel anxious, and then we start to get depressed. And so the psychological ailments come from the nervous system that hasn't allowed itself to release. So in somatic therapy, you'll come in and tell me, I don't know, about a fight with your parent or a spouse or even a boss. And I'll go, as you're telling me that, what are you noticing? Well, my heart's starting to race, or my stomach gets tight. And so then the narrative goes to the side. We don't really care. We'll go into now the body. Your body's going to guide me as to what it needs. So then I'll say, let's notice that. Notice that tightness, or notice your heart beating fast, and let's see what happens next. So if you give your body enough time, the body knows innately how to release that extra energy. Many times people will say, oh, it started to dissipate. Okay, that means it's releasing. Or up pops a memory from when my dad, walked in on me when I was a little kid, and that scared me. So this then event triggered that event that hadn't been fully completed. And so then so it's about that. It's a heightened, it's the nervous system being in that fight or flight that kind of gets stuck there.
So feelings being attached to the memories.
So yeah, so for example, as a little kid, if we lived in chaos or had a violent parent, the body goes into fight or flight. You want to fight back, but you can't. Because it's too scary because the person's much bigger. And so that wanting to fight back gets stuck. So we work with the primitive part of the brain that doesn't know the difference between real or imagined. And I'll say, okay, if that little kid could have done anything, what would that kid have wanted to do? And so if that becomes too scary, okay, who would you invite in? Or, when I first did it, it was something my sister had done, and she said, if you could do anything. And I said, because I love the Incredible Hulk and grew up on that show, I said I'd have the Incredible Hulk beat her up for me. And so, okay, imagine that. And all of a sudden, I started to feel this release in my arms. So my shoulders went from this to this because I felt this release, and I was letting go of that fight that, I couldn't do when I was a kid. And that's how you start to release all that stuck energy. And if it's a lot of, it depends on what you're working with, you take little drops because a lot of people are so afraid of the anger. When you've got a lot of, repressed anger, it feels like rage, and it can really be scary. So you work with it very, very slowly, very
Can you
gently.
mention something too about it? Because some of my people that have been scared to do SC because they think they're going to have to remember the event.
No, we don't even, the narrative, the story, we really don't care. You just start with one line, and then your body will start reacting, and then we'll go with what the body. So then all of a sudden you have tightness in your tummy, and then you notice that I'm feeling coldness down my arms. Okay, let's go with that. Notice that coldness. That many times is the freeze response, letting go, And so then the body guides us. I'm guided by your body. I don't really, not that I don't care about the story, but the story is secondary.
Okay.
And you don't have to go through every traumatic, event in your life, because one releasing something right now can release a lot of the other stuff.
Right. So you're not being re-traumatized, which you talked about.
No, not at all. Not
Right.
at all. Not at all. And you need to make sure a good, somatic, and I've messed up sometimes where you have to really make sure, be cognizant of the time, and really make sure that you're not having them leave in a heightened, dysregulated state.
Got it.
Imagery is because, again, the primitive part of the brain doesn't know the difference. So at the beginning, you're always just looking for resources, which we call them. What calms you the moment you think about it? It could be a color, it could be a flower, it could be a place, it could be, your pets. A lot of people use pets, and so think of them. And when you start and tell me about your dog, and they start talking about it, and you see the smile on their face, you see their face relax, and and I'll say, okay, notice how you feel now when you're talking about, I don't know, Chip, your dog.
Yeah.
And they notice it. So once you feel it in your body, you realize, it's different than saying this is how you're going to feel to actually experiencing it.
Right. Keyword
Yeah.
experience. Exactly.
Well, that's why he called it that. Because I asked Peter, I go, hey, Peter, somatic experiencing, it took me such a long time to even understand what that meant.
Yeah.
Somatic is just a fancy word for body.
Yeah.
And experiencing it is because you experience it in the body.
Yeah.
So that's basically what it means, experiencing it in the body.
Yeah. Wow. Which is super important. I mean, you can go through a class and you can learn things, but you don't know until you actually go through an experiential, right? And
exactly.
Yeah.
There's so many people not connected. Their mind and their body are not connected. I was one of them. Yeah.
So we have time for one more caller because we're almost out of time. So let's get Sharon on the line. Sharon, I believe, is holding from Ohio. Is that right?
Yes, it is.
Hi, Sharon. How can we help
Sharon.
Hi, Sharon.
Hi. I was just very interested in I spelled it wrong, somatic experience. they just discovered, it's been about 4 years now, that I have PTSD, which leads to high anxiety, which leads to severe depression. And in April, I actually thought my only way out was to leave. And I'm doing talk therapy. They keep trying to push pills on me. They don't agree with me. And I was interested, I'm not getting out of this rut. I'll be fine for a couple days, and it's the subconscious, the dreams, the wanting to leave, because I feel that's my only way out. And a different modality I thought would be maybe helpful to me versus talk therapy.
I think so. I think so. What area do you live in?
Ohio.
So go on the link that John is going to put up, and under search for a practitioner, then you'll be able to put your state and see if you could find a therapist that's close enough to you where you can go and see them.
Yeah, I put that in the comments, Sharon, but I'll also put it on the screen for people to see. But it's definitely, you go to directory.traumahealing.org, and that is the actual practitioners directory.
Okay, so traumahealing.org.
I definitely need something other than talk therapy, because I feel it's stuck in me somehow, or a set belief that I'm gone. A part of me was taken with the trauma and the death that I witnessed of my significant other, and
oh my goodness,
I'm not myself, and it bothers me. I'm type A personality, but I'm a completely different person, and I don't want to be like that. And this talk therapy doesn't seem to be, doing anything for me.
Yeah.
I would definitely look at the somatic experience. I think, Sharon, you're going to find an extraordinary experience by doing that.
Yeah,
I really
absolutely.
feel that.
It sounds like it's right. It can really help even the teeny bit that you described, which is what the trauma is. The nervous system goes into fight or flight and feels helpless, so might go into freeze or even collapse, and then you're stuck there. And so certainly anxiety is going to rise, because what's anxiety? Fear. Oh my God, I won't be able to protect myself. What's underneath the anxiety and the fear is, I'm not going to be able to protect myself and I'm going to die. It's a fear of death. Because you won't be able to, because you couldn't protect, so it all it's all like a domino effect from that. And I think if you don't have a lot of developmental trauma, a lot of, unresolved wounds and stuff from your childhood, I mean, even if you do, but I think even a few sessions can be really helpful, and you'll notice a difference.
And then Kelly, would you?
Okay, because my problem is more, I don't care if I die. And that's not a healthy way to think.
Sharon, what's your birthday?
8/31/59.
There you go. Okay. Because you're an 8 of hearts, you come in with great emotion. So you feel things greatly. And also you come in with great responsibility. So I want to say this from the bottom of my heart. You're very loved and you're very protected. Please go get some help. Okay. Please get some help on this one. Okay. Because you come in, you're a master. Are you aware of that?
I'm told that I'm an empath, I'm something else, but
Oh, you're definitely an empath. So get some help, because somatic experience will really help you release a lot of the shock and trauma that happened. Okay. It will help so much, you're not going to believe it. Here's another thing I would do. Again, I'm going to suggest a homeopathic remedy, something that just moves you a bit, because you come in you have a very strong life path, honey. I mean, like beyond. So there is nothing if you wanted to fix this and move through this, you can. I can tell you right now, you can. Okay.
thank you. I need some hopeful words, because
Okay. Yeah, I know you do. I know you do. You're actually you're a huge empath. I want you to look at Dr. Robert Gramlich's work, and John's going to post his. He does homeopathic remedies. I think you're the perfect candidate to have a session with him. And then I would find a somatic experience therapist. I would do both. I would definitely do both. It's funny. I actually almost said to Shirley and to John, I can't take any more calls because I actually have to go.
Oh.
And I'm so glad that we took your call. I just want you to know that Spirit had a plan here, because I literally was just about to say I can't take anymore. I have to go.
Yeah.
Mm.
Yeah.
But I am really, really glad that you called, Sharon. I mean,
Yeah.
really glad you called. So you just go listen, go look up Dr. Gramlich, set up a session with him, and go to this is where I get real directive. And then look at Shirley's when John posts the somatic experience. There's some great somatic practitioners there that will
Yeah.
really help you through this. Okay, because I agree, talk therapy is just not enough.
Yeah.
Yeah.
And would you think
No,
Okay.
having maybe a session with the medium, Kelly, would also help as far as
If you want to come
connecting
in
with
and
the
of course
three?
have a session with me, you can reach me at kellywhite.com.
Yeah.
Kelly, what is my email again?
Kelly at
Kelly at kellywhite.com. Yeah.
Mm-hmm. Yeah.
I think everything helps, particularly when you've had a loss like that and such a traumatic loss.
Mhm.
And it's certainly Kelly could really help you.
There you go.
But thank you for calling. I hope that helps, and please let us know how you're doing.
Yeah. Keep in touch with us, okay?
I will. Thank you
All
so
right.
much, and thank you
Thank
for your
you.
show. I appreciate it.
Thanks so
Thank
much.
you. Okay, well, we have to run. We will be here next week. I'm not sure what our topic is next week, but we will figure it out and let you know on
I think
social
We're
media.
considering
Probably do
doing
a
a show on triggers coming up as
yeah.
our next psychological topic because we
Oh,
did
good.
a little bit about that. So
Mhm.
maybe possibility on triggers and more into the fight or flight response. So we're thinking about that for the psychology shows, but we have a lot to talk about too for the spiritual shows. But keep those
Yeah.
comments coming because we appreciate you guys letting us know in the group
Yeah.
what you'd like for us to discuss. That's how we get
Okay.
these ones.
Yeah.
Yeah.
All right. Have a wonderful rest of your day, everybody. Thank you for listening.
Thanks so much, everybody. Thanks, John.
Thank you.
Thank
Take
you,
Thanks,
care,
John.
Cheryl.
everybody.
Bye.
Bye.
You've been listening to Both Sides Now, featuring the unconventional duo Dr. Shirley and Kelly White. Two
All
perspectives,
right.
one world.